Hello, Dr. Minkoff.
Hi, Michelle.
I'd like you to tell us a bit about what the difference is between how patients are treated at LifeWorks versus how they would be treated if they saw a traditional doctor.
Sure. I was a traditional doctor for a long time. I was a pediatrician. And if I was going to make a living, I had to see 40 kids a day. So if you work that out in an 8-hour day, that's not very much time per patient. Patient would come in, I would get a very quick history, I would do a very quick exam, I would find out that they had an ear infection or a throat infection or whatever it was, I would write the prescription, the patient would go away, and they'd be rechecked in 2 weeks' time. That is sort of a traditional approach. You got a symptom, I give you something, you go away. The patients that we're mostly seeing now are people who either want to live longer and better, want better performance, or they have chronic bad illness, autoimmune disease, cancer, things like that, rheumatoid arthritis, Lyme disease. And you can't do that kind of medicine with that because you just won't get anywhere with them. You have to take time with the patient. You have to get to know them. Our patients fill out a 14-page history form so that we know really all the things that have happened to them, what medicines they've been on, and what their history has been, and what doctors they've seen, and what tests that they've had. Because our job is we have to actually learn intimately the patient, what their symptoms are, so that we can figure out what is actually wrong with them, what has gone haywire, because they weren't sick before, now they're sick. And so the approach is to discover that. So it's a research and discovery job. And when we do it well, we find out, oh, your zinc is low, your selenium's low, you're missing essential fats, you have a high lead level, and on and on and on. And when we find those things and correct them, then patients miraculously get better. There is a healing force within the body. And when that healing force is no longer suppressed, the patient will get better. And that's what we do.
Thank you.